Welcome to Healing the Tigress, a podcast of stories and conversations on Asian American Pacific Islander maternal mental health. We are your hosts, Peggy, a licensed clinical social worker and certified breastfeeding peer counselor,
and Jasmine, a clinical pharmacist with a perinatal mental health certification. Both of us are Taiwanese American mothers and survivors of postpartum depression and anxiety.
We don't know about you, but we didn't grow up talking much about mental health in our families, and we want to change that now that we are mothers.
Together, with our clinical backgrounds and passion on the subject, we want to create a safe space for the AAPI community to discuss perinatal mental health issues.
And together, we want to break generational cycles in our own parenting journeys so that we can heal our inner tigress, a nod to the tiger moms before us. We are so happy you're tuning in here. Let's get started. A perinatal mood and anxiety disorder that we don't hear as much about is Perinatal Obsessive Compulsive disorder, or OCD. In fact, perinatal OCD is the most misunderstood and misdiagnosed of the perinatal mental health disorders. It can affect as many as 3 to 5% of mothers, and perinatal women have up to 2 times greater risk of OCD than the general population. Perinatal OCD is marked by the presence of obsessions, compulsions, or both, which are time-consuming and cause significant clinical distress. Obsessions are defined by recurrent and persistent intrusive thoughts, and compulsions are defined by excessive, repetitive behaviors or mental acts in response to the obsessions.
So today we are honored to have a guest with us to discuss her own experiences with perinatal OCD and how she now supports moms as a co-facilitator of perinatal OCD support groups for Postpartum Support International, or PSI. Please help me welcome Allison Livingston, who I first learned of her story from one of the U.S. Office of Women's Health Talking Postpartum Depression campaign. I was also asked to share my story briefly in this campaign, and in doing so, I actually recognized Allison as one of the other East Asian faces represented on the website. So, Allison, thank you so much for agreeing to talk to us more intimately about your postpartum experience. Would you mind telling us a little bit more about yourself, your cultural background, and let's talk about that first before we dive into your motherhood story.
Yeah, of course. Thank you so much for having me, Jasmine and Peggy. This is an honor to be on a podcast. I love it. Um, especially AAPI. It's such a non-talked about topic, and there are so many of us out there, and we're just hiding amongst amongst ourselves. So I'm a Korean American, and I was adopted at birth. My parents got me from South Korea. I was only about 2 or 3 months old when I arrived in the States, and I have 2 brothers, and they are not adopted. I grew up in a very cold, snowy place, and now I'm living in a more sunny, nice part of the state. I have my bachelor's in international studies, and I have my master's in early childhood. I was a teacher for a while, and then I became a mom, and it was like my job shifted, my career shifted, my life shifted, and I then became an advocate for perinatal OCD, awareness, education, and working at postpartum support.
That is awesome. And so, I guess that sort of leads into your motherhood story. And can you tell us a little bit more about that journey? How was your pregnancy, and kind of what were the first signs of a perinatal mood and anxiety disorder in your postpartum experience? Or even if it was in, pregnancy or before that. I'm not sure we've actually talked about that. Yeah.
Yeah, so I actually, looking back, was diagnosed way later than I really wanted or had hoped for. It's like if I had known, I would have gone back, etc. But I was experiencing panic in the pregnancy period with my daughter. I have 2 children. My daughter was first, and now I have a son. And I really experienced perinatal OCD just with my daughter during the pregnancy period. I was having, the typical nausea and the typical pregnancy, healthy growth, low risk, but I was having these panic moments. Right before bed, I would kind of sweat and kind of freak out and feel like I couldn't breathe, and I thought that was just like worry, I'm pregnant, etc. But that was definitely the first sign of my OCD.
And then after the pregnancy, did it get worse?
Yes. So, I delivered my daughter, and my perinatal OCD just heightened. It exploded. A few days after birth, I remember having this moment of intrusive thoughts, extreme fear, anxiety, and thinking I was going to harm her or she was getting hurt somehow. And she was literally sleeping, but I was just so worried about her. Fast forward 6 weeks or so, I had thought I hurt her, and like on the Office of Women's Health video, I stated if anything were to happen to her, I would take my own life because I was just so dark, so anxious. And then it wasn't until about 8 or 9 months out that I realized something was very off. It was not just new mom anxiety, which I kept hearing. I kept hearing that. And I feel like so many moms out there still hear that to this day. No, you just have new mom anxiety. Um, but I was having intrusive thoughts. I was having so much anxiety uh, about everything. I was constantly reassurance seeking, which is leading into my OCD, contaminations and my compulsions and my obsessions. I had a lot of contamination worries of her getting sick, of me getting sick, my husband. I was avoiding people, places, things to do, enjoyable things. Um, I had checking, so I was looking at the baby monitor like all the time, even though she was right there. She was totally fine. She was totally safe. I just needed to look. Um, I also had tracking and record keeping, and I didn't know that that was a compulsion. I was just like, oh, well, I need to document and make sure that I know that she was breastfeeding on this side for 14 minutes and 3 seconds. I can look back or whatever it was, my rationale. But I was very, very anxious.
You kind of, thank you for sharing those details. I think sometimes it can be sort of helpful not just to hear like what it's labeled as, but more specific, like concrete details of what's going on. Because I also remember like those baby trackers, and I would like log them every time, and I'd be like, did I log it? And I'd ask my husband, like, did you log it? Like, did you change her diaper? Did you log it? Um, but I guess it also depends on how severe it gets to the point where it's affecting your daily life, right? It's taking over.
Yeah, that's usually like the marker is like it is impeding your ability to like function, which is the case for most, if not all, of these perinatal mood disorders. It's the things that you're experiencing that are distressful, but that it's impeding your ability to move forward and do things. Like if the checking is preventing you from really getting anything done or being able to take care of yourself or the baby. And those trackers are terrible.
Yeah.
I wish one thing I would tell new parents:
Oh,
don't download the tracking apps.
yeah.
I
Looking
know,
back, I
yeah.
wish I did not do that too,
Yeah,
because it
same.
definitely does create a lot more distress. Yeah.
Yeah.
And
Yeah.
you also mentioned like intrusive thoughts. I mean, we don't have to go into details about them, but can you describe a little bit like intrusive thoughts, because I feel like a lot of people will say, oh, I have intrusive thoughts, or like, what is an intrusive thought? Or how is that different than like psychosis? Or can I even disclose this to my doctor? Because what if they really think I'm going to hurt my baby and they take my baby away from me? So, how do you think intrusive thoughts are related to OCD versus like psychosis?
So OCD is very different from psychosis because of the intrusive thoughts and the anxiety that goes with it. As a new mom with perinatal OCD, you will have an intrusive thought. I specifically had one about harm. I was thinking, I'm going to harm my daughter. I'm going to push her off of me. like, I just can't. And it was because I was overwhelmed. I had so much anxiety. It was just too much. I was overtouched, touched out. Um, and with that intrusive thought, I did have that worst case scenario. So I told my therapist, who told me to go get talk to my doctor about it. And my doctor was actually out of town, so I had a nurse practitioner who had never seen me, didn't know my history, first time meeting me. And I was explaining how I was having like scary thoughts, kind of about harm. I was very hesitant to really go into detail, but I was also so desperate at that time. This is 8 months out. And that nurse practitioner believed that I had psychosis. And she actually called Child Protective Services on us, and we had them come to our door. We had
Oh,
social workers, we had police officers, we had everyone that you can imagine checking to make sure that my baby was okay, that I was okay, and that I didn't have psychosis.
Was the provider a perinatal specialist by chance?
No,
Okay.
no. And she also had never had children and was very not aware.
One of the things we've been learning in the PMHC training is like what to do when a mom discloses these things. And it's like, do not actually call CPS right away because it can cause more distress to the mom. I'm so sorry that happened. And I'm glad it did not spiral further from that situation.
Yeah.
I feel like that's hard because I don't want to discourage people from disclosing what they need to disclose. But maybe there's the other piece of like, you really need to also check and advocate for yourself and see, is this person somebody that may be sensitive to what I'm about to say? Is this somebody that will actually take me seriously and have my best interests at heart? Obviously, people think when they're calling CPS they're having your best interests at heart or your kid's best interests, but if they've, like you said, this person wasn't a mom, had never dealt with this before, like, and that just sucks that she was that person that day. um,
Yes.
but I want to like make sure that other moms know that there are advocates out there for them. And maybe that PMHC tag is such a good thing to look out for nowadays because
Yep.
you know that this person has some sensitivity to these issues. So I feel so bad that that happened to you.
But it was also such a great blessing in disguise because I became an advocate. I wanted everyone to know that I didn't have just depression and psychosis. I had something that nobody talks about, which is perinatal OCD. I want every new parent to be aware of it so that that doesn't happen to them because it is really distressing. It is really hard. And talking to a provider about it, even your friends and family, is so scary. And especially coming from like an Asian background, like you don't talk about that, especially mental health in general. I know I don't have Asian parents. I didn't have the whole, career, money, all the stereotypes that you think of when you have Asian parents. But I am Asian and I became a parent, and so I have the same responsibilities. I still experience the same identity shift, wanting to be the best mom to my children. Um, and I think that's really important that people hear that.
I think the other piece that you mentioned was like, the fact that people thought you had something else, right? Perinatal OCD, like kind of Peggy mentioned, is often misdiagnosed. It's confused with maybe other perinatal disorders, and I mean, when I learned about it in our training, it was like as many as half of primary care physicians will misidentify, and then 80% will misidentify harm obsessions. So maybe kind of like that nurse practitioner. And then the other thing is like 65% of the women actually have comorbid depression. So were you first labeled as having postpartum depression before OCD?
Yes. I was like hitting everything that you're you're listing on the stereotypes.
Yeah.
Yeah, no.
Yeah. But But you did have some depression as well, so it was like kind of hand in
I
hand.
did,
Okay.
but I wasn't experiencing the um, the typical depression that you think of. I was able to get out of bed. I wasn't having intense crying spells. It was more the OCD, the anxiety that was really present.
Yeah. They always say anxiety and depression are like two sides of the same coin. So I can see how having to deal with a lot of the intrusive thoughts and cope with the obsessions and compulsions and being aware of them, like you're aware that you're doing them, you're aware that you're thinking these things, that can cause that depression because it's distressing. I think that's the root definition of it, is having it to be very distressing as well. And so it would make sense that 65% of women have comorbid depression. And maybe it's not. I think
Mhm.
there's this understanding that depression feels like very deactivating, like can't get out of bed, but there's also depression that feels very activated and very like in very anxious, and so I think that's one thing for people to also know, that you can still be depressed and be essentially looking very functional, right?
Yeah, for sure.
Right. I think that's what's good to highlight in your story is, like you said, you weren't having the low energy form. That's the form I had. But that it can still be depression because I mean, you're not happy with the situation, obviously. Yeah, so I'm glad we're talking about this in this way to sort of show people that yeah, it looks very different for everyone. Everyone's constellation of symptoms are different. So then, who was the person that ended up helping you to diagnose your condition?
It was my therapist and her coworker. So she was really skeptic about diagnosing me with postpartum depression. She was like, "You need an antidepressant. I need to send you to your doctor." And then the whole nurse practitioner, blah, blah, blah thing happened. But then she connected with her coworker and she was like, "But this patient is just not showing those PPD signs. Like, she has something else." And her coworker was like, "I think it's something called OCD." And of course, when she told me that, I was like, "Oh, come on. Like, I'm clean, I'm organized, but like, I don't have that. Like, I'm not like wiping it down like 8 times. I'm not flicking the light switches, like exactly what you think
Hmm.
of OCD."
The stereotypes, yeah.
Exactly. And that show, Monk, I was not doing that. I am very clean. I am organized. So that was, there's also a fine line, but it's more of the intrusive thoughts, the
Mhm.
constant compulsive behaviors, the little piece of relief, and then the re obsessing, compulsive, just that horrible, vicious cycle. That's what I was experiencing.
Yeah. And it kind of looks different for everyone. So
Hmm.
it's why, like, we can't just box people into this stereotype, like Peggy is saying, like, oh, you're only worried about, counting and cleaning, and, it can show up in other ways. Like, we had
Hmm.
another guest on who was explaining she didn't know she had OCD until many, many years later when she also became a therapist. And she was saying that, like, she would need to have a certain amount of liquids in a day to make sure her breastfeeding was going well. And if by a certain time of the day she hadn't drank a certain amount of liquid or she didn't have liquids with her, she would like basically kind of freak out because it wasn't, she wasn't keeping up with it. And so that was her sort of obsession and need for control and compulsions. So it looks very different in every case. Yeah.
For sure. Yes. There's like a whole garden variety. And if you go on Treat My OCD, it's the NoCD website, it talks about all the different types that you can have. And it's pretty informative and very educational.
I'm glad you're bringing up some resources. Like what other things would you say are helpful for people who might be looking for more resources? Or I wonder even like did you need like to see a specialist in OCD to get treatment?
Yeah, typically that is highly recommended, especially if you're in the perinatal period, making sure that they are PMAD aware and they have OCD experience
Mm,
and they're trained in exposure and response prevention, a type of therapy.
okay.
I would 100% recommend the IOCDF website. This is a website that specializes in OCD, but also there's a page for perinatal OCD sufferers. It's educational, it's informative, and I helped with the task force. So there's a lot of great information on that.
Can you tell our listeners a little bit about what exposure and response prevention looks like?
Sure. So I have a great example. I had extreme anxiety around trash bags, which sounds really bizarre, but it's the crinkle sound, like the plastic. And then on every plastic bag you ever see, it says like, not a toy, do not let children play with, children can suffocate. Every single plastic bag you see will say that on it. And it went into my mind and became an obsessive compulsive disorder for me because I was so worried my daughter was going to suffocate. And so I would hear the crinkling and I'd get really anxious. And my compulsion would be avoiding. So I just like wouldn't want to touch any plastic crinkle sounding bag. It would like make me cringe. I would freak out. So I would just like avoid it and like go in the other room, etc. My therapist walked me through and explained to me ERP, exposure and response prevention, and we worked on plastic bags. So my exposure was around first the crinkling sound. I would really focus on listening to it. It was giving me anxiety, but I was building up a tolerance. So it was a bell curve. I had that exposure. I would listen to it. I'd build up from 10 seconds to 15, for example. And then slowly I would be able to get the relief when it stopped. I then would build it up so that I could touch plastic bags. I could be around plastic bags. And then eventually I'm just changing trash bags. Like there's nothing there. So I had that bell curve. I was exposed. I had the anxiety, but then I was able to conquer it.
How long did that take, that whole process to like being able to actually change out the trash bag?
Yeah, that was probably a month.
Okay.
Yeah.
Yeah.
And it's just I was it was homework, so I was weekly getting into it, really working on it. Yeah.
Okay.
Yeah, it's like it helps desensitize you to the stimuli, right? There's a stimuli, it creates anxiety, but then also it's like rewiring you to be like, okay, but it's the anxiety, but that's it. It's not leading to the actual thing that you're afraid of. It's not leading to your child suffocating. Like little by little, kind of like titrating yourself to being like, I can take out the trash.
Exactly. It's almost like a
Never thought we would
metaphor,
work on something
right?
so that you could take out the trash, but
Yes,
hey,
something like
these
that,
are the
right?
things. But that was such a great example because I think that there's probably so many little things that other folks that are suffering with perinatal OCD are like, how will I ever be able to do X, Y, and Z again? And knowing that this is an option for treatment.
Yeah. Thank you for sharing that. And so, do people who have ERP experience, is there a way people can easily identify if a therapist has OCD training or ERP training under their belt?
So Postpartum Support International has a great directory, and you can filter
Okay.
by looking for what they specialize in. And the NoCD website, Treat My OCD, is a great because it's specifically for ERP trained therapists.
Okay.
The IOCDF website also has a lot of great materials, and you can find a provider that way.
Okay.
Those are the ones that I have really encountered and worked with.
Yeah. And we can link all of those in our show notes so that people are able to find those websites and directories. Because I think that's important for people to know like where and how to find somebody to help them more specialized. And Allison, I know you also have mentioned, besides for ERP, you also use medications, right? Are you okay with sharing with us a little bit more about that?
Yeah, so I originally, when I was first diagnosed, I was like anti-medication. I think it's also very common with people with OCD to feel like it might be a contamination,
Mm,
and that would really mess up with the baby and your body and etc. So I was very hesitant to take medication, wanted to explain that. I was going the natural way. I was drinking too much water, not that you really could, but I was like excessively drinking water. I was trying to exercise, I was trying to sweat it out, just really work on getting rid of the OCD, even though
mm.
I really couldn't. Um, so I needed medication, and I started on um, the generic brand of Zoloft, which is sertraline
Sertraline.
and sertraline. Yes,
Hmm.
and I started it, and um, I had read up on the IOCDF website that medication for people with OCD actually needs to be really high, the
Mm,
number and the amount. And I was nervous to dive in and start taking that, but I was also so desperate and I knew that I needed something. So I started taking um, Zoloft, and I started taking a high dose. I was experiencing just the typical symptoms, 6 to 8 weeks of really like tired, um, really just really exhausted, trying to get it through my body and working on that. I think one of the huge parts of my treatment also though was that I could name my disorder, because I
mm.
was like, this is not just depression. This is not just anxiety. And then knowing it was OCD, I was like, oh, there's a name to this
Mm.
crazy.
Yeah.
And I was so relieved. So I think my treatment was the exposure and response prevention, medication, as well as naming my condition.
Yeah. I think there's a term, actually, we use it even in like with kids and parenting. In Dr. Daniel Siegel's like whole brain child, he says like a big part of it is naming it to tame it, right? So when I was reading that book, it wasn't even like for myself. I was like, oh, I just need something to distract myself. Let me read this parenting book. And then I'm like, oh my God, I needed to name things for myself. Like I needed to name it to tame it.
Yeah.
And even myself just admitting I had depression was something big so that I could learn more about it and like figure out why was this happening to me and how do I get better from it, right? And also maybe knowing that like it's not your fault, like you didn't do something,
Yeah.
this was like a chemical imbalance, there was something like wired wrong. Or and I was reading about like how OCD, a lot of it is like the serotonin system, transport system is a little bit off, as well as you have a lot more higher cortisol levels in your system with people who have OCD. And so I think actually a maybe it was a psychologist I had seen. Um, she was trying to explain to me like, it's not just like the serotonin imbalance, but you probably postpartum right now, you're only like, 5 6 weeks postpartum, your cortisol levels are probably super high. And I didn't even think
Mhm.
about that. I was like, oh my gosh, yeah, that is a stress response, and that might be why I can't sleep. So I love that you said that like a big part of it was also just admitting that like this is what's happening and going on, but now that I know, I can figure out how to treat it.
Mhm.
And destigmatizing the medicine because there was a component maybe of neurochemical that you needed to work on. um, yeah, it's scary to take that first step though, I know. And I know you have like you mentioned that this was more with your first daughter, or not your first daughter, your daughter. um, did you do things differently to prepare for your second pregnancy, or was the experience different with your son?
Yes, that's such a great question. And I get that a lot. So after I had my daughter, I was one and done, 100%. Like I got rid of all the onesies. I got rid of the strollers. Like I was so done. I couldn't imagine doing this again. And then I got pregnant with my son, and I just felt so confident. I had
Mm.
so much support. I had named my condition. I had the medication, the tools, the resources that I needed. And I was like really ready. And having my son was a completely different experience. Pregnancy was completely different. My support team, my family, I was just so much more prepared. And my expectations were not the whole rainbow and butterflies. It was, this is going to be hard. This is a different way, but here we go. Let's try this out. And my son, he's great. It's totally different. And I don't have such severe perinatal OCD. And I say that because I will have OCD my whole life, and I always have had it. It was just heightened during that pregnancy and postpartum period with my daughter. I know how to control it. I know what it is when it comes to me now. And so I can say I have more controlled perinatal OCD.
Okay. And were you on medication during the pregnancy as well as after?
So actually I tapered off like you, Jasmine, before I got pregnant with my son.
Mm-hmm.
And then the second trimester, I started up on a small dose and I increased it.
Okay.
And I'm still on medication to this day. It's not a high dosage. It just needs to be part of my daily routine, though. I just
Mm-hmm.
need that extra serotonin.
I love that you're sort of normalizing that because I think that like people can be so scared of medication during pregnancy. And then one of the worst things sometimes you can do is completely stop and not be on anything during the pregnancy. But the risk of untreated illness is also very great. And obviously I think since you went through such a like big experience with your daughter, you knew you had to do things differently the second time. um, and I think it's good to normalize that some people may have to use medication long term, and that's okay because you need it. And like, what's wrong with somebody who needs a blood pressure medication every single day of their life? Like, what's wrong with needing a small dose of Zoloft every day of your life, right? If that's going to
Yeah.
help you function, I don't see why not.
Mhm.
Yeah.
Yeah. Um, and then I guess that kind of leads to the work you do now. Like, how did you get involved with PSI? It seems like you've been pretty active in just OCD, this OCD world. You know, being on a task force to write up things on that website. Can you tell us more, like how you got involved and what you do now?
Yeah. So I have a friend who works at the IOCDF, the foundation, and I actually spoke to her once I was initially diagnosed, being like, I think I have this OCD thing. Tell me more. And we talked a lot about it, and she was like, yes, yes, I think you do too. And she was asking if I wanted to join in on a perinatal OCD task force, and I hopped on the opportunity, and then I slowly worked for them for a little bit, volunteering and connecting with other people. And she connected me with um, Postpartum Support International, and I started to co-facilitate a peer support group, and it's the Perinatal OCD group for moms. I co-facilitated that on Tuesday nights for a year and a half or 2 years, and I had to switch to a different time, but I still co-facilitate with PSI. And I then was offered to work as a float. So I work as a float coordinator. I help parents and families in need the Pacific time zone, Mountain time zone, and Texas, because Texas is basically a country. And I also am currently the international coordinator manager for that program. So I speak to people all over the world.
Wow.
That's amazing.
And I love hearing these stories of how you turn lemons into lemonade and
Mhm.
you really make
Mm.
meaning out of like something hard that you went through so other people don't have to go through it. So it's really refreshing to sort of see how you've turned that around and now you're helping other moms. Um, with these support groups, I noticed there were two. There's one for moms, one for parents. I'm assuming
Yeah,
parents means like dads can come or like
partners.
partners. Yeah. Can you explain a little bit more about groups though? How do you sign
Yeah.
up? Is it free? How many people? How does it work?
Yeah, so if you go to the postpartum.net, get help, and then online support groups, these are free support groups. They're offered every day of the week. There are several different wells, they call them, because we are using a platform called Share Well. You're welcome to browse, find which one seems like a good fit, and sign up and register. They are a variety of people. Um, I help co-facilitate the Perinatal OCD group for parents. So you and your partner can come at any time. We have them every other Friday. And group looks like what you think of um, an AA
Hmm.
experience, so Alcohol Anonymous. You go in, there's all these strangers, it's kind of awkward, but you actually AA has been around for so many years because it's so successful. So peer support is one of the most successful, amazing treatment options. You feel less alone. You can make friendships out of this. And it's just a wonderful experience for everyone. Um, there is a 30-minute education piece around OCD. And if you attend a different group, there's a 30-minute piece around that specific education, whatever group you choose. And then it's about a 60-minute talk time, we like to call it. So you are talking amongst each other, just what's going on, how your experience is, what brought you to group. Um, just getting validation, hearing from other people, and sharing your story is really empowering. So I highly recommend any of those groups if you ever want to join. It's really awesome.
Thank you for sharing that. I think it's important sometimes for people just to hear a little bit a preview of like what that's like, so they feel like, is this right for me? I felt like I always was thought that group wouldn't be something for me because I didn't want to like air out my dirty laundry or just like why am I complaining
Right.
with a group of strangers or like talking about this with a
Yep.
group of strangers. um, but the more I learn and been doing this for a while advocating, I realize it is helpful. That group is
Mm-hmm.
helpful. I don't know if part of it is just like being of the Asian background that we're sometimes like a little bit more ashamed or,
Mhm.
save face kind of thing. But that's why I think it's
Yeah,
important to see people who look like you.
Mhm.
That representation is kind of important. Like, oh my gosh, I'm not the only one, going through
for
this.
sure.
Yeah.
Yeah, and we only require camera during these online support groups for your introduction.
Oh.
And otherwise, you can literally sit back, listen, you can be in and out. It's totally up to you. Um, and to put name to the face, face to the name,
Hmm.
I will be also speaking about OCD at the PSI conference this this year. So I can meet people in real life and hopefully represent a little bit more AAPI.
That's awesome. Um, is there anything that's like stood out to you or that you've taken away from facilitating these support groups for OCD?
So much, actually. So again, I was kind of hesitant thinking like, oh, I'm going to be part of an AA group. This is awkward. Um, but it actually is super helpful. Everyone benefits from group. Um, just validation, hearing from other people, feeling less alone. And then the education piece, I learned a lot myself. I can read off the slides and tell everyone what OCD is, but I actually gained a lot of that information myself and was able to use it in my everyday life. We also like to close with a good piece of self care and thinking ahead of what you can work on for you. And I think that is a very important part of group as well.
Yeah. We do that here too.
Mhm.
on our
Yay!
on our podcast. Um, but yeah, thank you so much for all this. I think it really helps to de-shame a little bit, and I think that's what we're trying to do, is that like a lot of these mood disorders, and especially something like OCD, is a little bit less talked about, a little less understood.
Mhm.
That the more we talk about it, I feel like we can have more empathy and compassion for other people who are going through it. And sometimes, even with depression or anxiety, you can have OCD characteristics, but it may
Mhm.
not be like clinical OCD.
Mhm.
So yeah, I can sort of relate to some of those things you were saying, because I was like, man, I was really anxious about
Yeah.
certain things like that myself.
They do say there is like, I think there's a study that showed there's some level of OCD symptoms that almost all new moms are experiencing, but the difference between those OCD symptoms and full blown like perinatal OCD is how long it lasts for, and that it's actually very common to have those OCD symptoms. And there's even a slight protective factor of why we would be having them. But when they become way bigger than that and last much longer and become very distressing and impeding, that's when it's perinatal OCD. But there is some level of OCD symptoms for a lot of moms.
Yeah. I think they even say like
Yeah.
intrusive thoughts are pretty common. Like, I don't know, like
Mm-hmm.
80 to 90% of moms will get
Yes.
Yeah.
them, because you're
Yep.
trying to foreshadow maybe, or just think of like
Yeah.
um the scenarios where you have to like protect your baby. And I think again, that's a nature
Right.
thing, right? You're trying to um
Yeah.
look out for your baby. Yeah.
And I think that's why it's so important for providers who are listening, that when you are assessing for these things, that it's actually helpful to say, some moms have intrusive thoughts about harm coming to their babies. Has it happened to you? Like leading the question that way versus like asking, have you had thoughts of harming your baby? Right? Like that is a much harder question to answer as a new mom versus like, sometimes it's actually pretty common for moms to have those types of thoughts. Wonder if you have been having them or stuff like that. And the big protective factor is it's these intrusive thoughts of harm happening to your baby. And there's the anxiety of like, I need to protect my baby from the trash bags. They also mentioned that the difference between the psychosis is the psychosis will be more like, I have to, XYZ my baby so that they can be the new king of heaven or something, like that's where it's
I think it's
borders on.
rooted in like not reality, basically.
Exactly. Yeah.
And you're also, I think with a lot of OCD or intrusive thoughts, you are aware that this is distressing, that this
Hmm.
something is wrong about this. But with psychosis, it could be you think this is rooted in reality, and you actually really really believe it, and there's a disconnect, like something is off about that. So I think, yeah, the good thing to tell people is, if you're distressed about it or worried about it and you think this is wrong, you're probably okay, in terms of like, you're not going to actually hurt your baby.
Yeah.
um yeah.
Yeah, that's a very good point. Yep. Psychosis is more hallucinations, out of touch with reality. You often hear things that are not existent. Um, and you don't have the anxiety or the distress with the thoughts. You are actually willing to do them.
Yeah. Allison, I didn't ask you earlier, but how long do you think it took for the medication to feel like, you felt more normal again? Maybe not even just the medication, but like overall in your journey, like when did you start to feel like, okay, I have control over things? Like maybe the combination of medication and ERP is working. Like, how long did that take?
I think that was probably a 6 month to 1 year out. I
Okay.
was able to let go. I was able to feel more confident and controlled. Um, and yeah, it was just all the combinations, focusing on group, naming it, uh, therapy and medication for sure.
Okay. Thanks. That, I think that might be helpful for someone listening. Like, what can I expect? And I mean, not everyone's journey is the same, but it sometimes can be helpful to just sort of have an expectation, like, okay, maybe this is going to take longer than I thought, right? Or
Yep.
maybe it'll be sooner than I thought. So I think it's nice to sort of hear somebody's experience. And if you go to group, I'm sure you'll hear everybody's different kinds of experience as well. So that's where you can get more feedback and input, right? Yeah.
Yeah.
Well, I guess we'll end our group talking about something for self care for you this week. We like to end our podcast usually like everyone goes around sharing about something they might want to do for their mental health this week. Either you've done it already, you're thinking about it, and it gives our listeners maybe some ideas and tips for them to, they're like, oh, maybe I want to try that this week. um, so, does anybody want to go first? I'm trying to think.
I have one.
Okay.
I don't know how I got into this, I was reminded of this because our last, I feel like our last episode or one of our last episodes was like Divya was talking about Wordle. You guys were talking about Wordle or something. I
Yeah.
wasn't there because we were talking about Wordle. And I started getting into Duolingo. This episode is by no means sponsored by Duolingo in any way, but I was getting into Duolingo. I don't know if it's because of all the ads I get or whatever, but like I had it for a really long time and I was like, let me get back into it. And there's just something really I just sit there and I just buzz through them. Part of it's because I took French for 6 years and I'm like in the very intro lessons. And so they're really easy for me to get through. But there's something really like relaxing about almost for this, it's mindless because I know it so well. If I was trying to learn a brand new language, it probably would be really stressful. But I'm just like bloop, 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 bloop. And there's something like really relaxing about getting the points and getting the gems and then trying to compete with random strangers. And I've been like I see these people on the leaderboard and I'm like, oh, Summer is number one. I need to be this is where my competitive comes in, that I'm just like going through all these challenges and then you can do challenges with your friends. And my friend was like, how have you done 50 lessons? Don't you have an entire child to take care of? I'm like, excuse me, sir. First of all, I'm doing this lesson while he's taking a bath. So don't you judge my parenting. And second of all, I did pay for like whatever. Anyway, so I have like the main subscription where I'm just like going through them. But anyway, it's just been a nice way to take my mind, like a mindless activity that is also educational, because then I'm like, oh, my French is coming back. I'm getting better at this. So that is my self-care, is picking up this language that I probably am not using anyway, but it's just nice to like not have those 6 years from like high school and junior high go to waste.
I like that. That's cool. I've never, you'll have to show me next time what that looks like, but I definitely hear those ads. And I have to admit, I have no idea what that would look like, but good job. I think
Thanks.
that's cool to be, maybe there's something like nice about being half productive and half mindless.
Yeah, right? Because it's like it's mindless only for the fact that like I'm doing really easy lessons right now, but also I'm like, look at me picking up my French again. So
Do you have something, Allison?
Yeah. So I love making like mini art projects, not like a little painting or something, but I'll make like a little greeting card. There's always like a birthday, like
Oh,
always.
yeah.
So
Oh, my
I
God.
just make like a quick little greeting card, birthday card.
I think art can be such a good form of self care that we often forget. I mean, wasn't there this big craze for a while where people would, the coloring books, right?
adult coloring books.
Yeah,
Yes.
the adult coloring books with
Yeah.
like, funny sayings or mantras or whatever to get you through the day. So that's a good one, I think, the artistic side. For me, I think one thing I've done recently is I've decided to increase the frequency of my therapy sessions with my therapist. I have been a little more down lately, just feeling the heaviness of the world, and a lot of it is sort of getting to me. Trying to feel, I guess I feel like sometimes very angry, sometimes very helpless. And so I had a session with my therapist recently, and I was like, man, I think that was really helpful, like to be able to talk it through. And I was like crying during the session and like apologizing. And she's like, why are you apologizing? Like, it's okay to like cry. And I think
Mm.
that just comes from like some of the way we've been raised. Like,
Mm-hmm.
it's like, it's almost like, oh, I'm sorry for making you feel uncomfortable that I'm crying. But no, like
Yep.
I think that release was really good. And so I told her, can we meet a little bit more frequently than we have been? Because I think I had been okay for a while. But I'm noticing now over the last few months, like I think I need it more frequently. So I think just for myself, I've decided to increase that. And I think that's okay to, not always be on the upside. And sometimes you take a step back and you might just need some more support. So I'm going to admit to myself that, I'm going to see her a little bit more frequently.
You're titrating your therapy.
I am self-titrating. I mean, she's helping, but I think it's important to recognize. I feel like I'm seeing it show up in my physical body, and just I'm like, I need to do something about this whole thing overall. So yeah, that's mine. So thank you, Allison, for your time today and sharing with us. I think this is going to be very helpful to people who might be looking for this resource, just like anybody talking about it. Please, and especially in our community, I feel like this is a topic. I don't know if I've ever heard anyone of Asian descent talking about this. I don't know. That's so you are a gem. I'm so glad we have you on.
Oh, yay. Thank you for having me.
We hope you have enjoyed Healing the Tigress in our conversations on maternal mental health in the Asian American Pacific Islander community. Please follow our show and our Instagram page to catch our latest episodes. We have so many fantastic guests and deep topics that we are so excited to cover soon.
If you enjoyed this episode or would like to support us more, please leave us a rating or a review and share this podcast with a friend to spread the word. Check out the show notes for more links. Thanks for joining us today, and we hope these conversations will help our AAPI mothers heal their inner tigress and honor their mental health as they deserve to. See you next time.